On-pump CABG is the conventional method in which heart is arrested using potassium-rich cardioplegia solution and the heart-lung machine takes over the circulatory and gas exchange functions of the body. In on-pump CABG, also called OPCAB, off-pump coronary artery bypass, heart is fixed using suction devices and it continues to beat while bypass grafting is done. But the procedure is technically more demanding for surgical skill and potential risk of incomplete revascularization may occur. The theoretical advantages of off-pump CABG are the reduction of systemic inflammatory state related to cardiopulmonary bypass, microemboli, increased permeability of blood-brain barrier, and aortic manipulation during cross-clamping and cannulation. In spite of these theoretical advantages, one study showed that number of off-pump CABG in United States declined from a peak level of 23% in 2002 to 17% in 2012. According to that report, a minority of surgeons and centers do perform OPCAB in most of their patients. In a comment to this report, another author commented that off-pump CABG requires careful patient selection and special expertise to achieve the potential benefits. A review of the then status of OPCAB was reported from Japan in 2020. At the time, 65% of CABG procedures in Japan was performed using OPCAB. After a literature review, the authors mentioned that many randomized controlled trials indicated that the acute phase and long-term mortality rates were comparable between OPCAB and on-pump CABG, or that OPCAB was inferior to on-pump CABG. In contrast, many observational studies had shown that OPCAB was superior to on-pump CABG. The authors concluded that CABG is a delicate procedure and outcomes vary in accordance with patient's condition as well as the level of expertise of the associated institution and surgeon. They hope that in future reports will emerge with excellent results, including long-term results from Japanese institutions experienced in performing OPCAB.